G'day, Michael McCullough here. I'd like to record this presentation to try to help setting up a digital SLR camera to use in clinical dentistry, particularly to taking images, good intraoral images of oral mucosal diseases for monitoring for changes that could be the early recognition of oral cancer. Many of you would have already have the PowerPoint or PDF presentation regarding this from DHSV, but I wanted to remind you why we were going to do this, and it's really about oral cancer screening and prevention and looking at mucosal diseases. These are 6 clinical images that are of different mucosal diseases, the top 3 of various ulcerations, with traumatic ulcerations, chronic traumatic ulceration, squamous cell carcinoma, and a recurrent aphthous stomatitis. And of course, that's a major recurrent aphthous stomatitis that had lasted for 5 or 6 weeks, which would give you some considerable reason to concern that the top 3 images from left to right. Down the bottom, we've got a patient who has lichen planus with their left and the right buccal mucosa imaged on the bottom left and the middle on the bottom images that we'd been monitoring over a period of time, and she subsequently developed this area on her tongue which which was a squamous cell carcinoma shown by biopsy and afterwards removed and treated successfully because we were able to pick it up very early. Now, all of these things with mucosal disease, different mucosal disease have different malignant potential, and the only way that we can really monitor these often is by taking good intraoral images of the mucosa to show changes with time. And this is a kind of representative of the different potentially malignant conditions that we have in the oral cavity: leukoplakia, erythroplakia, lichen planus, potentially hyperplastic candidosis, and of course submucous fibrosis with people who are using betel quid, betel pan over an extensive period of time. And they all have the red on those arrows as kind of representing their malignant potential. Not all of them are definitely, someone will get cancer, but some of them have a higher risk, like erythroplakia and submucous fibrosis, of developing cancer. And our ability to be able to monitor these patients with time really comes down to the early recognition of this condition, squamous cell carcinoma, that has occurred in these 3 patients, and timely referral so that they don't develop like that first image on the left-hand side, which had been left for something like about 9 months before diagnosis. Whereas the one in the middle was recognised very early, biopsied, and successfully treated. So I think the use of a digital SLR is very important, and I'd like to try to record me putting together a camera with these PDF of these instructions so that you too can put one together and start using it. And the more you use it, the better off you'll be in taking intraoral mucosal photographs. So I've tried to reproduce this pretty much the same way that it's set up on the screen in this video, and you should find that all of those things that are present on that you need to put this camera together, hopefully you have, which includes the lens up on the top left hand side, the body of the camera. You need a ring flash on the as shown on the top right hand side, of course some AA batteries. They're coming back in the middle. Those two batteries that are there in the middle are the batteries that go into the body of the camera, which you can use. That's these ones here, and you can use them interchangeably. This here is the charger that will charge these batteries for your camera, for the body of the camera. This is really critical, the ring flash adapter. So I'll show you how to stick that in. The compact flash card, of course, compact compact flash card to record things, and to get the pictures off the compact flash card you'll need this, which you'll plug into your computer as an adapter for the SD card. It's not a compact flash, it's a SD card. And probably the most important is the camera lens, as the strap for the camera that I'll show you how to put on the camera so that you don't drop this rather expensive piece of equipment. So the first thing to do is to go and put the get some energy into the ring flash. There's little instructions, right down there. Of course, they write it in black on black of how to put these things in, but hopefully you'll be able to see there's a particular order that these things, that the ring flash needs to have its batteries in. Once in there, these batteries will tend to last a little while. It's probably a good idea to get some ones that you can reuse and recharge. Check and make sure it makes a noise, which it does. And you've got a battery, and you probably should just leave that at TTL. But we'll come back to having that set up, which is through the lens metering later on. So it's good. We've got power inside the ring flash. The second thing I do is to turn around and change this, because I never use the back of the lens like that. Turn it around and always have it so that it's looking at you, and you can stay like that. These are really strong cameras, so that you just could leave it like that all the time. Sorry, before we put the power into the body of the lens, the battery into the body of the lens, we'll take off the cap that's there. Just twist it around and get the back of the of your lens. Take off these caps and get the two of them to join up together. The easiest way of doing that is to get the little red dots, the little red dot that is here on the body of the camera and the dot of the on the lens. Line them up, which they should do, and then twist them around. You should hear a nice click as it comes into place. So the next thing to do is put on this ring flash adapter. Without the ring flash adapter, and there's a bunch of these, there's about 3 or 4 different sizes of them. So find the one that fits your lens, twist it on, which should go on very nicely. Get the main body of the ring flash itself, and there's little bits on the side that you can press in, and as you're pressing them in, it opens up little flanges that are on the inside of the camera, inside of the ring flash, and as you press it in, place that in position, let it go, and that'll capture the ring flash. And then you've got to slide the body of the flash on the top of the camera and screw it up tight so that it's locked into position. Not too tight, but it should hold it in position. So we've got all of these, the camera and the ring flash on position. The next thing is to make sure that we can, whatever photographs that we take, we get recorded on our compact flash or SD card. Various types of this. Hopefully you got one that's got plenty of space on it to keep your images, but you're going to keep taking the images off all the time anyway. There's really only one way that slides in, and as you push it in, it grabs a hold of it and keeps it in position. Find a battery that is it's got a bit of power in it, and hopefully the camera will come to life. Place the battery in position, close the lid, and switch it on. To the on position, and it's functioning. So go across and change the time and date by moving these arrows around left and right and changing the numbers associated with that. I won't do that now. You need to set the top dial here onto M, which is for manual, not AV, which is aperture controlled, or TV, which is the shutter priority, or P, which is program. Now, if you're not using the flash and you're just taking a photograph of a label or a patient, then the P works very well. But to take intraoral photographs, you need the camera set to M. To change that, we move this dial up on the top right hand side of the camera, which is just behind the button, the shutter button. Move this so that it's sitting around about 120, 125, and then to change the focal depth, hold the AV button down there and move the same dial. And this is the most important. You need to have this out pretty much the biggest depth of field, which is the highest f-stop on the camera, which is the most important. Of course, we've got to tell the camera where we want it to focus. So if you hold down that little button, which looks like a 4 little dots in a cross, press the button, press the shutter halfway, and you should get the back lighting up. Press that in, and you can have the difference between automatic selection and manual selection in all the different areas that the camera's seeing. You could even have it in the center or back to automatic selection. Probably best to leave it at automatic selection. And then when you've got something to focus through, look through the viewer, and you should be able to then focus on something. The camera, when it does come into focus, will beep and take the photograph, and takes a beautiful photograph. There's a lot of different options that you can have the ring flash set on, and you can change that by changing the mode. And you can see at the moment it's ETTL, which is electronic through the lens, and a ratio of 1:1 left and right sides. You can change that to all sorts of different things that can get pretty complicated, telling it what type of camera you have or the way you want to photograph it. Just leave it through on the ETTL, through the electronic through the lens, and the camera and flash will sort it out. Probably though, the most important thing when you're setting this up for your clinic is to make sure that it doesn't get dropped. So have this, put this on. It's a little bit fiddly, but put it on through the little connectors that are on the side, so that anybody who's using it can hold it around their neck, and hopefully it'll survive. And of course, these beautiful photographs that you're taking are no good unless they become part of the patient's record. So to get them to do that, take this back out again, the little SD card that's got all your photographs on it, and stick it in the right socket with this one, and plug it into your computer, load it on. Sometimes I always think it's a good idea to take a photograph of the patient's name before you take the patient's photographs, so that when the person comes to loading this into your practice management software, they know whose clinical images they belong to, and they can easily find the patient's record. So hopefully you've got the camera and you've got the images in your practice management software. A couple of tips here for taking good photographs. Look through the camera viewer to determine what you're going to take a photograph. What you see is what you should get the photograph of. If you press that little shutter on the top right-hand side of the camera halfway, you'll be able to, it should come into focus. The camera will try and find the focus. It'll beep, take the image as soon as you hear the beep. If it's too light or too dark, then just adjust the shutter speed, which is that first one that I put at 120, 125, but you can vary it between like 1 in 30 to maybe 1 in 160 to change the color of it, the lightness of it. If you can't get into focus, move further away. You need to be 31 centimeters. So give yourself a bit of distance. You can always zoom in. That's going to take a fantastic photograph once it's in focus. Secure the cap. Make sure it's around your neck so you don't drop it. Good, yeah, so don't drop it. But I thought I'd add a few more slides at the end here to go back over stuff we've been talking about with the camera, because you're really only going to set up this camera once. Once you've set the camera up, you don't set it up again. You just pick it up, switch it on, and take photographs. So a couple of things to remember. You've got the settings within the camera, the biggest f-stop that you can. Frame the photograph that you're taking. I'm just going to talk about the depth of field in a minute, but frame the photograph that you're taking. Practice taking a half press, pressing the shutter button halfway so that it focuses, and that'll stop you getting camera shake. I want to talk a bit about retracting cheeks and tongues and your real need for a chairside assistant, use of mirrors to take photographs, and maybe a bit about flash lighting. So to reiterate the depth of field, which I said a couple of times, is the most important part of taking a good intraoral photograph. The smaller the lens opening, which means the larger the f-stop, the greater the depth of field. The problem is, the greater the depth of field with a small aperture, a small opening, you need more light and a slower shutter speed. So because of that, you need the macro lens. That's what the macro lens and the ring flash is all about, is getting light into the patient's mouth so the macro lens can take a beautiful photograph with a quite slow shutter speed and a really large f-stop, so a big depth of field. And it's a really old image that on the right there about how the f-stops work and the depth of field with the same amount of light. When you go to take a photograph, think about the framing. Think about what you want to you want the image to look like before you start. You know, if you want the buccal mucosa, the lateral margin of the tongue, the floor of the mouth, and how you're going to take that photograph. Think about positioning the patient. I've pretty much always taken photographs with the patient sitting up rather than lying down. The principal reason is that the tongue kind of falls into the back of the patient's mouth when they're lying down. When they're sitting up, it sits in a more natural position in the floor of the mouth rather than the back of their mouth. And it's easier for them to move and for you to stand, because that next bit, positioning yourself, is really important. Being able to stand in a way that you can be balanced, taking the photograph, you'll get a much better photograph. Shooting using the half press, as I said, getting it to focus and locking the focus so that the kind of image is frozen. You don't want to hold it too long because the patient will move. But doing that fast half press, freezing the focus, you'll get a much better photograph once you fully press the camera, press the shutter to take the photograph. You really need help to take good intraoral photographs. You need your chairside assistant to be fantastic at it, doing the retracting and even reversing it so that you do the retracting and your assistant takes the photographs. You can't retract as well as take a photograph. I've tried and I'm not very good at it. You need two people to do this. So you've got to practice with each other and make sure you're doing gentle. If you're taking a photograph of mucosal lesions and the patient often, if they're ulcers on the mucosa, if you stretch, you're going to hurt the patient. So you're better off cupping rather than stretching. Maybe using plastic versus metal retraction. I prefer metal. The plastic ones, depending on what color it is, it's going to change the composition of the photograph. And using a dental mirror, on the right there, I've got little things about the different types of mirrors that are around. There's different sizes. They're wide ones or full arch ones or narrow buccal surface ones. Whichever you use depends on what photograph you're taking. But remember to warm them up a bit beforehand, because you don't want to get the patient's breath sort of frosting the mirror just as you're about to take a photograph. And that left-hand bottom dot point, in a COVID world, we need to think about infection control, which I'm sure you will be. But remember, this is why we're doing it. We're taking photographs to watch things on the mucosa that we're concerned about that may well be just trauma, and we're doing something to remove the traumatic area or the thing that's causing the trauma so that we watch it resolve. And the photograph will reassure us and the patient that it's resolving. And if it isn't resolving in an appropriate, timely fashion, or if you're looking at chronic mucosal conditions such as lichen planus, you can observe them over time, and a really good photographic record of that, what the mucosa looked at the time that you were taking, at the time that you were examining the patient, will help you and your patients enormously. So thanks, and I hope this has helped. And as I said, this is about setting up the camera. Once you've set it up, keep using it, and hopefully help your patient as much as possible. Cheers.